Right, I hope you can hear me all right. It's a real pleasure to be here today. It's lovely to see some very familiar faces dotted around and some new people. I have been, let's get the first. Working in the field of epilepsy for more than 40 years, all right? So I know it doesn't look like it from, too young, aren't I? Look too young, right. And so what I'm going to do in my session today is look about coping with anxiety and depression. And I have a plan. This is my outline. I'm going to talk briefly about anxiety and depression as it occurs in epilepsy. I'm going to look at recognizing symptoms of anxiety and depression. Are you anxious? Are you depressed? Look into treatments, maybe how to source them. And there'll be a little interlude. Let's do mindfulness interlude, so hopefully we can have a de-stressing time. And then finally looking at lifestyle changes. So in terms of anxiety and depression, there's a whole body of research now that shows that there is an increase of anxiety and depression as clinical conditions in people with epilepsy. Community-based research estimates there's a 1 in 3 chance of somebody with epilepsy developing a clinical disorder in their lifetime. And this compares to 1 in 6 in the general population. Okay, so some of you may have experienced one of these disorders already, and some of us maybe have one of these disorders in the future. And the most commonly identified diagnostic categories is social anxiety disorders, generalized anxiety disorders, and depression. And the rates are higher than in some other chronic conditions, most notably asthma and diabetes. Now, what's the most worrying thing is not the high incidence is a worry, but it's that 1 in 2 people haven't or don't receive treatment. Either they have not been referred, or they've been referred for treatment, but decline to have treatment, be that medication or psychological. And one of the reasons that people decline is because of the stigma associated with a mental illness. So if you've got epilepsy, there's also stigma in having epilepsy. So if you then have a mental illness, then you've got a double whammy of 2 potentially stigmatizing disorders. And the quote at the bottom was from a young woman I saw a few years ago now, and this sort of encapsulates her reluctance, really. She said, I thought seeing a psychologist was for people who were nuts. So this reluctance to go and have treatment. So there are many reasons why anxiety and depression rates are high in epilepsy. There are the seizures. Seizures are unpredictable events. You don't know where or when you're going to have a seizure, and that can make it very stressful living with it. But also, certain seizures, certain people experience anxiety and depression as a symptom of their seizure. So people may experience in the hours or days before a seizure a change in mood, and also after the seizure there may be half an hour or days of low mood. So these are sort of seizure-related mood disturbance. Medications can cause side effects which can affect mood. Also, in between seizures, if the networks that cause your seizures are also those networks that are important for regulating emotion, then this may also cause mood disturbance between seizures. We heard briefly this morning about surgery. Surgery can be a very effective treatment for epilepsy. Most commonly undertaken is temporal lobe surgery, but the temporal lobes form part of the emotional regulatory network. So about 1/3 of people after surgery will experience a mood disturbance, albeit treatable. There's living with epilepsy, the stigma may be a fact that causes low mood. Also, epilepsy may also have other hidden deficits. We heard Tom this morning, he's talking about a language problem. He cannot always get out the words he wants. And that's a hidden deficit, as are memory deficits that are quite common in epilepsy. So looking at Tom, I can't see that problem, and nor can the general public. And these can cause considerable stress. Lack of social support is associated with mood problems generally, and also there are money worries, and we're going to hear about benefits subsequently. I have just had such an increase in people who are so distressed by their encounter with the benefits services. So that has become a real cause of low mood, really extreme low mood. So going to anxiety, anxiety in itself is a normal emotion. We all feel it from time to time. So, and a certain amount of anxiety is good because it motivates us to do things. So I have been anxious preparing this talk, but that anxiety has made me try and put things together so that I'm not here unprepared. But so you have anxiety that can get us to revise for exams, giving talks. There's performance anxiety for sportsmen, and actors will talk about anxiety, stage anxiety, which does, unless it gets too high, is positive for performance. So, do I have an anxiety disorder, or do you have an anxiety disorder? So, it's given when worrying thoughts are going round in your head hour after hour, day after day, week after week. So it's persistent anxious feelings. And they can be of the form, people will laugh at me, they'll think I'm stupid, or worrying about something awful is going to happen to members of your family, or to yourself. I'm going to die. So these really quite pervasive thoughts. You're feeling anxious, you're nervous, you're on edge, you're stressed, you feel scared and panicky, overwhelmed, you're probably quite irritable. And then there are physical signs, tense muscles, dizziness, breathlessness, chest pains, palpitations, headaches can all be symptoms of chronic anxiety. And it's this inability to switch off and unwind. And because of the anxiety, you may then begin to start avoiding people, stop doing things you once enjoyed doing. And the problem with anxiety, one of the many problems, is it spirals. So you get anxious, you get panicky, you can feel then depressed about feeling like that, you get more anxiety, more panic, more depression, so you get this vicious cycle, which can sometimes be difficult to break into. So I'll leave you to think whether you're anxious. Are you depressed? You could have both. You could have both. So in terms of being depressed, it's persistent low mood and sadness. You feel hopeless, you feel helpless, irritable, you're impatient with others, other people get on your nerves, you have difficulty concentrating, you're increasingly forgetful, you can't make decisions even what socks to put on in the morning, you feel mentally slowed down as if somebody's poured treacle on your brain, you just really can't function. And physical symptoms, changes in appetite. It can be either an increase in appetite, so-called comfort eating, you find you're on your third packet of biscuits, and it's only sort of 8 o'clock in the morning, or your appetite goes down and you just feel you're knotted and you just feel unable to eat. Sex drive can be affected. Sleep is often disturbed. Again, it can be that you're sleeping too much or that you're unable to sleep. And just motivation goes and you lose interest in things. And then this can impact on social settings. You find that you're struggling at work, you avoid contact with friends, you're neglecting hobbies and interests. And even routine, important tasks such as cleaning your teeth, changing your sheets, you just got no interest, you just don't do it. And so at its extreme, people can take to their beds for days and days, and so there's self-neglect. So, treatment for mood disorders. If you've decided you are anxious or depressed, then what are the treatments? I think it's important to establish whether your mood disturbance is related to your seizures or not. Because if it's happening before seizures or after seizures, then what you need is better control of your seizures. That's sometimes easier said than done, but. And then the NICE guidelines, the NHS guidelines, recommend psychological treatments for mild to moderate depression. And the most commonly advocated are counselling and cognitive behaviour therapy, and then drug treatment for moderate to severe depression. Often people may be on a combination of, are referred for both. Now, drug treatments, there are a range of anxiolytics and antidepressants for mood disturbance. Some of these are not advised in epilepsy because they can drop the seizure threshold. There are also anti-epileptic drugs that have dual action that can, on paper, treat both the epilepsy and the low mood. One I'm thinking of is clobazam. Clobazam or frisium is an anxiolytic. It's treated for reducing anxiety. It's used for treating anxiety, and it's also an effective anti-epileptic drug. So, psychological treatments. Counselling and CBT come under the umbrella of talking therapies. Counselling, this is difficult to generalise, but counselling usually refers to, is more of a listening space, a time to go over your concerns and worries, and often it may be non-directive, so the counsellor won't tell you, well, you must do A, B, C, and D. It's a safe space to vent feelings and to try and put things into perspective. Cognitive behaviour therapy can be a bit more, is more structured usually. There are set programs that people go through. It's about challenging these negative thought patterns, teaching positive coping strategies, and it's the most widely prescribed on the NHS. So, NHS talking therapy services have developed over the past since about 12 years, and the service is called IAPT. So you'll often feel, you may go and see your GP and they'll say, oh, well, I'll refer you to IAPT. And you think, oh, God, what's that, But what it stands for, it's an acronym, Integrated Access to Psychological Therapies. And this began in 2008. They using evidence-based therapy, so there are controlled trials showing the efficacy of these therapies, and they tend to be CBT focused. So you see trained therapists, and currently they say that they're treating about 1 in 6 people with mood disorders, and their aim is for this to go to 1 in 4 by 2021. There's also a newer pathway being developed for people who've got chronic health problems, and that is a bit patchy where that is available. Increasingly, IAPT services take self-referrals, so you can refer yourself, but access is also via the GP. And how you go about it, how well this projects, if you put IAPT services or NHS psychological therapies into a search engine, you at some point will get this screenshot up. And what it is, it's find psychological therapies, and you put your postcode in, press search, and it will tell you what the services are in your area. You can then online, or you can phone them up and ask them to send you paper, if you like, application forms. So you fill in a referral online, giving basic details, name, address, who your GP is. And then there are a lot of questions, and amongst them are, what is the main problem here? What is the main problem that you would like help with? How is it affecting your life? Are you quarantined? This is one from Barnet. If yes, provide details, areas most affected, what feelings are you most troubled by? Please select what you've tried in the past, and that's a drop-down list there. So you can, as I said, refer yourself. There are also being developed online psychological therapies. So you don't meet anybody in person, the therapy is conducted online. And this is just one of the digital therapies that is available. They haven't been scrutinized that well in terms of efficacy, and that's something I think that is on the plan of action for NICE. You can get CBT for depression, anxiety. They have programs for sleep disorders and social anxiety. And it's free to NHS patients, and it's available in some areas. It's available in Camden. I wasn't able to have time to go through just to look where it is available. But to have access to it, you must be registered with a GP. And what you do, you get an activation email, you're matched to a therapist, and they will contact you. And if they think this approach might be suitable, then you can begin therapy. And it has things to do online, exercises to do between sessions. So I was able to find a review. This is a 5-star review by Catherine of the service. I've had 2 sessions with my therapist. It's been very good. I thought it would be impersonal, but it definitely wasn't. My health issues are fairly minor, but I'm treated with respect, compassion, etc., etc. So she's given this, obviously got along with this. But I also found a 1-star rating. What is this? Therapy it is not. I had 2 sessions before giving up. I was given a series of questionnaires every week. My problem is that I am depressed after being redundancy. So every week this person sent questionnaires where he had to just go over and over, yes, I'm redundant, I'm not working, and found the whole thing of filling in the questionnaires was a little soul-destroying. So it's one approach. Just want to briefly mention mindfulness. I'm sure there cannot be anybody here who hasn't heard of mindfulness. There's probably practitioners of mindfulness in the audience. It's very widely promoted. Mindfulness is ancient practice, goes back to Buddhism at least, so thousands of years old. And it's learning to be in the present. That's probably oversimplified, but a lot of the time, we are worrying about what's happened, what's going to happen. We've got things going around. And it's really about just trying to switch that off and just live in the moment. And there are mindfulness therapies, mindfulness coaching and exercises. And some of the exercises are really very simple, may involve more controlled breathing, about focusing attention, engaging the senses. There's also mindfulness colouring. So if you go into any, I passed Hatchard's bookshop on my way here, popped in, you can find mindfulness colouring books. It's used in schools, it's used in sport, it's used in Parliament to have introduced or have encouraged people to have mindfulness sessions. In prisons, and I heard on the radio a week ago somebody who was the United Nations mindfulness consultant. And NHS guidelines recommend it as a way to prevent depression using it. So I thought we could have, I'm going to share with you here, we're going to do mindfulness, all right? So I'm going to give you the 5, 4, 3, 2, 1 strategy, okay? And it's trying to disrupt anxious thoughts. So I hope you're sitting in a comfortable place. If you're not, there's not much I can do about it. So I just want you now, you don't have to obey, but it would be nice if you did, just to close your eyes. To close your eyes for a minute. And in that time, just think, what are you thinking about? What is going on in your head? Okay, you can stop. It's a bit less than a minute, but I'm anxious of the time. I'm anxious about the time. So I don't want to know what you're thinking about. You can always share it with me later. And I just want you to take a few sort of deeper breaths. And then I'm going to run through this, which you shouldn't do, because it's mindfulness. So 5, 4, 3, 2, 1. You stop. You look around you. 5 things you can see, and you focus on those 5 objects or things just for 30 seconds, a minute, but you focus on that thing, so you don't let your mind wander. So I'm going to do this, so I'm focusing, this would be my first object, the lectern here. I'm focusing at our chairman, that's my second object, that's probably right, okay. I'm looking at the camera, so I spent time looking at the camera. I'm looking at the child here with the electrodes on, and I look at my shoe. So you look at each one in 5 things. 4 things you can touch. I can touch my trousers, I can touch this. So each time you spend longer with them. I can touch my hair, I can touch the computer. 3 things I can hear. I can hear my own voice. Getting a bit sick of it at the moment, but I can hear my own voice. What else can I hear? I can hear pounding, I can hear my heart thumping, and I can't hear a phone, which is good. I can hear sort of a buzz. There's a sort of a buzz, going on. All right. 2 things I can smell. Well, I give myself a quick spray before I came on, and that's really quite nice. And I've had some hand cream, so a different smell on that. 2 things I can smell. And then 1 thing I can taste. So I have a round mint with a hole in. Other mints are available. So I taste a mint. So 5, 4, 3, 2, 1. And you can do it sitting here. You can do it as you're walking along. You can do it while you're waiting for your cancelled train. So it's a way of trying breaking those thoughts. Also within mindfulness and CBT, there are often relaxation strategies or learning to relax. And now there are a large number of apps available which talk you through relaxing. And these are just some I put here. These are ones that are available. And beside them, some have a free trial for 30 days or so. Some have free aspects of the apps, or some are free throughout. The one I'm most familiar with is the third one down, Headspace, but this does have a free trial, but thereafter it can be expensive, and it works out about £70 a year, which if you're on limited money, that's a bit steep. But it comes quite highly recommended, and I have a number of GPs who use it themselves as a stress-reducing tool. Just briefly to talk about another sort of strategy, or coming on to a strategy, that we know that having epilepsy can lead to social isolation, reduced social support networks, and it's extremely important to have social support networks, because when we get depressed and low, we usually talk to friends, and if you haven't got that network, then you're very isolated. And there's a lot of research showing that low levels of social support is associated with high levels of mood disturbance. So, as I said, long-standing and robust research finding. So I think things have improved over the last couple of decades because of social media. So I think social media provides a way of linking up and keeping in touch. There are epilepsy forums and groups, which I'm sure you're all party to or involved in. So it increases the opportunities for engagement, means of increased emotional support, practical support. But as we heard this morning, there can be some very negative sides of social media. There can be bullying, and there are surveys that do show that use and engagement with social media can be associated with increases in mental health problems. So it's a balance. So it has positive, but I think very much you'll all be aware of some of the negative. Right, just in the, have I gone? Right, so in the last section, I just want to talk about lifestyle changes, because these can be associated with positive effects on mood, and it's something that's accessible to us all. So the first one is physical exercise, and there is increasing evidence that being physically active, doing regular physical activities, has a positive effect on mood. And GPs can now, and often do, refer people to exercise classes before they use prescribe antidepressants or before they refer to psychological therapies. And it doesn't need to be an intense gym program. I mean, gyms are really expensive. If you go on the NHS website, there are a range of exercises that you can go through or adapt, maybe 5 or 10 minutes a day for the first couple of weeks. So there's short home sessions, and there are other ones that they also run through what they call couch to 10K. So the aim is to run 10K, but you're starting off at the couch, and you just gradually increase. So it can be as slow or as quick as you want. So the other lifestyle thing is sleep. We sleep for a reason. We don't really know what all the reasons are, but sleep is restorative. And if you're not sleeping, it's going to impact on your mental health. Having a good nighttime routine, it's not using your screen in the hour before you're trying to go to bed. And certainly if you wake up at 3 or 4 o'clock in the morning, do not look at your phone. Do not look at your screen, because that will activate the brain. It just, you just won't get to sleep. Linked into what was said this morning, healthy diet. A healthy diet is good for physical health, but it's also good for the brain. So that's a strong thing to emphasize. And then finally, and I was interested with Tom, was it Dog Buddy? Yeah. Borrow my doggy. Brilliant, borrow my doggy. So there is a lot of evidence that having a pet or borrowing somebody's pet is good for psychological health, good for blood pressure, good calming part. And it doesn't have to be a big pet. We can't all cope with a dog. Dogs are expensive. So I am informed, I cannot talk from personal experience, that guinea pigs and rabbits and even I'm being fishist, and fish are also, you can have positive effects. Okay, so I think I'm going to wrap things up there, but I'll just leave you with an image of pet therapy in action. I thank you for your time.